Hello and welcome to the top 10 questions every person with neuropathy should ask. What is neuropathy? Well, so for this question, I went right to the Merck manual. If you're not familiar with the Merck manual, or also referred to as or known as the Merck Index, it's a medical textbook. It's been around for more than 100 years. I think the first publication was in 1899. And as you can see, the definition that's in the Merck manual I'm citing was updated in December of 2020. And I just think it's probably helpful for you to see what the definition is. I'm going to give you two of them really quickly. Peripheral neuropathy is a dysfunction of one or more peripheral nerves. Peripheral just means outside from the center. So you have your central nervous system and your peripheral nervous system, kind of like your peripheral vision. So your peripheral nerves, and you'll have sensory disturbances, pain, muscle weakness, atrophy. You can have one, you can have all of them, unfortunately. It can be diagnosed through testing or history and physical examination. And I think it's noteworthy to point out this last sentence from the Merck manual. Treatment is aimed mainly at the cause. That's going to be important for a couple reasons, because hopefully you know what's causing it. But on the note of what is neuropathy, so that's one definition, and it's probably from the most widely used medical textbook that there is. What is neuropathy? I like this definition. It's simple. It's to the point. If you have neuropathy, you basically have nerve damage. Take the word neuropathy, cut it in half. You have neuropathy. Neuro means nerve. Pathy means abnormal disease or damage. So there's still a lot of confusion. Neuropathy's been more popular the past 3+ years. You may have known, when watching this, you might have known that you've had it for 10 years or newly diagnosed, or you just suspect that you have it. Anyway, I want to provide clarification. So whether you have neuropathy, peripheral neuropathy, diabetic neuropathy, chemo-induced neuropathy, mononeuropathy, polyneuropathy, nerve damage, diabetic nerve pain, it all means the same thing. Sometimes they use different terms to name it for the causative factor. For example, diabetic neuropathy, or sometimes they'll name it for the area that's being affected. Again, peripheral, meaning the peripheral nerves. For this discussion, mostly we're going to refer to the nerves going down your legs and your feet. So peripheral neuropathy would be the nerves going down your extremities, your legs and your feet. Arms and hands as well, but it's much more common in the legs and feet. So that's what neuropathy is. I mean, cells become damaged. We're going to discuss that, and we'll get that answered in the next couple of questions, or a handful of questions coming up. What's causing my neuropathy? I basically see, so at the time of this recording, I've treated, worked with, evaluated neuropathy patients in the clinic for more than 14 years. Lots and lots of patient encounters, and there's about 3 scenarios that happen when people come in and we're discussing the cause of the neuropathy for the first time. Probably the most common would be or the most common, or popular, I should say, because it's not the most common cause, at least not my opinion, based on what I've observed through the years. And I'm indifferent to the most common causes. But I hear people say I have diabetes, so I have neuropathy, I have diabetic neuropathy. It's prevalent, it makes sense, we see it, that's one scenario. Next one would be people that have needed cancer therapies, chemotherapy. My doctor, my oncologist said that the chemo caused neuropathy, and that's why I'm here. Another scenario I see is, and I'll go back to the first point, being people walk in and they say I have diabetes or I don't. If they don't have diabetes, they've usually been told that it's idiopathic. Now, idiopathic neuropathy just means we don't know what's causing it. It's real, of course. I see it. It's not that common. And there's a reason I'm pointing this out, okay? Because I think it's important. If you go back to the first slide that we went over from the Merck manual, I mean, treatment, or it's always better if you can identify what's causing it. And there's just a lot of confusion because diabetes is a common cause, but it's not the most common cause that I see as a causative factor for neuropathy. So I think this is important to point out. Usually we can figure it out through more testing. And you rightfully so may be thinking that, man, I've had every test and I've had so many tests and the neurologist did these tests and this battery of, that's all true, fine. I'm not telling you that we can always put our thumb exactly on what's causing it, but I will say for sure, it's rare that we actually see idiopathic cases. I see lots of cases that are idiopathic, and then we go through their history and point them in the right direction on a test, or have them get certain tests done, and you can figure it out. So most of the time. So what's causing your neuropathy? Well, here's what I call the 7 most common causes. Cholesterol-lowering medicine, so disclaimer inserted right now, I don't prescribe medicine. I'm not suggesting or prescribing that you take medicine or cholesterol-lowering medicine. Don't let anything I say cause you to alter your dose. Talk to your prescribing doctor. Disclaimer. Anyway, cholesterol-lowering medicine side effects from that medicine, probably the most common cause. And then on top of that, if you say, well, most diabetics need to take cholesterol-lowering medicine, so they have, let's say, a double whammy. I know that's not a technical term or phrase, but so cholesterol-lowering medicine is probably it's the most common cause that I see neuropathy in my clinic. Diabetes, blood sugar disorders, that would be another extremely common cause. Anemia, for this discussion, keeping it simple, this discussion, anemia means you can't get oxygen to important tissues or cells, and then they don't have what they need to thrive, and that's really, unfortunately, the underlying essence of neuropathy is, cells, neurons, nerve cells, they don't have what they need to thrive, and then they become damaged. And unfortunately, damaged nerves die off. So anemia, another extremely common cause, see it all the time. It's not just iron anemia. I think there's more than a dozen types of anemia, but anemia noted as a very common cause. Thyroid. Thyroid could really be one of the top causes. This is not an exact chronological order of the causes here. Thyroid, in short, the thyroid hormones help our body make chemicals for nerves called neurotransmitters. Thyroid is unfortunately responsible or has a role in a host of neurodegenerative disorders, neuropathy being one of those. Cancer therapies at number 5, not second guessing the importance, the impact, the life-saving ability of any cancer therapy. But unfortunately, some have side effects. Number 6, AI and food sensitivities. AI stands for autoimmune. Your immune system is automatically attacking tissues or cells. And I put food sensitivities in there because there are dozens and dozens of autoimmune conditions. Rheumatoid arthritis, lupus, scleroderma, sarcoidosis, psoriasis, multiple sclerosis, the Hashimoto's disease. The list goes on and on. There are a lot of different autoimmune conditions, celiac disease. So I can't think of a case in all my years that was autoimmune and had neuropathy and didn't unfortunately have a food sensitivity with it. So I'm not telling you they're always, I lumped them together for this video for you. I think they unfortunately go hand in hand. So food sensitivities, if you're eating a food that triggers your immune system to attack tissues or cells, you'd want to be aware of that. So you can reach out to our office if you'd like to know how to have those tested if you haven't been tested and you suspect that. Stenosis. Stenosis, meaning narrowing around the nerves that come from the lower back or lumbar spine and go down your legs and your feet. And again, this does happen in the upper spine or arms into the hands. Most people I've worked with, period. Most of our patients are over the age of 65. Most people have a low back issue. They're extremely common. right? So whether it's degenerative disc disease, a disc problem, they've had surgery or post-surgical changes, stenosis, sciatica, lumbar stenosis, low back issues, they're not always the main or primary cause of someone's neuropathy. I routinely see it, and we also routinely categorize their stenosis as a contributing factor versus the primary cause. So what's causing my neuropathy? How bad is my neuropathy? This is imperative. If you want to get, if you're watching this video, unfortunately, you're probably already aware that you need to find out if there is a spectrum of neuropathy, mild, moderate to the most severe. You're unfortunately probably aware that you need to find out how bad it is right now. And I'll tell you exactly how to do that. A QST, quantitative sensory testing. We use a QST test. It is, to my knowledge, looking at research clinical trials, it's the most widely used test for neuropathy. I definitely would recommend it, a minimum once a year. Most of the time I have people do it twice a year, because look at the areas I highlighted. I think this says it all right here. You can use it to diagnose. I think the best part is you can assess the severity of the nerve damage. You know where you are. I mean, you have to know how bad it is. It'd be to start a planning process. Also, if you are under treatment or you're getting therapy for your neuropathy, you can use this test to determine if your neuropathy is responding. So you can't really do that with the nerve conduction study. Anyway, it's a great test. Have it done once or twice a year. Of course, we do it in our clinic. You should reach out if you haven't had one done. And by the way, I'm always noting where I'm citing where the information's coming from. This is from a division of the University of Chicago's Biological Sciences. So again, QST test, that is a cornerstone. You have to have a QST test done if you're trying to make any sense or headway with this debilitating condition. Will it get worse? Unfortunately, yes. So anything that you look up or read, whether it's a clinical trial study or an article, most of the time they acknowledge the unfortunate point that it's progressive, and I mean adversely progressive nature of this disease. And here's one excerpt from a medical journal here. In the early stages of neuropathy, patients present with progressive symptoms, including sensory loss, numbness, burning sensations. They go on to say that, sometimes that starts to dissipate. Those are, the way I think of it is, those are your nerves kind of honking on the horn telling you there's a problem there. And of course you're paying attention because it bothers you, or you can't feel, you have the loss of sensation, or you have extra sensitivity, or you have, unfortunately, some people have terrible pain with it. So yes, it's going to get worse. If you think about why it's happening, if you go back to the causes, let me use just a simple one. If you have diabetes and you're not, nerve cells have to have glucose, a certain amount of glucose. Too much glucose blows them up. So if you think about nerves respond to their environment, that's the reason most people are going to have neuropathy, or you have neuropathy. So if nerves don't have what they need to thrive, and go back to the second slide of siding with the Merck manual, you don't have anything to manage the underlying cause. You don't have any treatment aimed at that. Then unfortunately, it's just logical. It's going to make sense that if you're not doing anything to be very intentional about getting it better or keep it from getting worse, it's going to get worse. Your nerves respond to their environment, not some magical therapy. There's plenty of great therapies for certain types of neuropathy that I'll briefly discuss for you. But yes, it's going to get worse. I'm not being a pessimist. I'm not trying to scare you. You deserve to know. You want to be able to do things. You want to be able to drive, keep your independence, not fall, hang out with family or friends or grandkids games, whatever you want to do. You just need to, I want to provide some awareness here that it's unfortunately going to get worse. How bad can it get? I'm going to jump way ahead because we're not just talking about the aspects of life that you could lose. I mean, you want to know how severe it can get. So I copied this right off of the Cleveland Clinic's website, including the next question where it says, can neuropathy lead to amputation? That is from their website. Yes, especially diabetic neuropathy can lead to limb amputation. So not trying to scare you. I would want you to be aware of it. I will see people tomorrow. As I'm recording this, I currently have patients that have amputations from neuropathy. It is not, it's nothing to play with. You have to have good nerve function for tissues to heal. It happens. It's unfortunate, and ideally, you can avoid it by getting some of these next couple questions answered. Another excerpt here. This one was, I copied it right off of Johns Hopkins Medicine website. Be meticulous about caring for your feet and treating wounds to avoid complications such as the loss of limbs. So, it can be devastating. Can I live with it? I think this is huge. This is a big question because I'm told, from patients that they were told that you're just going to have to learn to live with it. How can you learn to live with something that it doesn't allow you to live with it? I mean, unless you know how to manage it. And folks, you're going to have a plan. Even if you want to stay the same, you're going to have a plan. The Journal of Clinical and Diagnostic Research says neuropathy is one of the most important complications which, if not recognized and treated early, may result in significant disability and a poor quality of life. I see this, unfortunately, on a regular basis. Some of you watching it may already be experiencing some of the disabilities that go along with it. Some of you may be on the brink of losing your independence. Wherever you are on the spectrum of neuropathy, for some of you, this can be managed. We'll get the rest of these questions answered and you're going to have a better idea because nerves can heal. I'm surprised at why this is still shocking to people. I mean, there is so much research. And most people have the fancy cell phones the research can be done on the cell phone. And if you just Google can nerves heal, or you look it up, or you go to any of these reputable institutions like the National Institutes of Health, the CDC, Johns Hopkins, Cleveland Clinic, the Mayo Clinic, they have these resources right on their websites where you can search nerve regeneration, nerve healing, peripheral nerve healing, can nerves heal. You can get these answers. It's probably, admittedly though, 18 years I've been working with nerve problems. 14 of those years I've spent working with this problem being neuropathy, and we will also want to say balance problems from neuropathy. I'm not suggesting it's that easy to do on your own. I want you to know that it's possible, and if you get it, if you have the proper testing done, that's where, like I said, the cornerstone, that's where it all starts. If you have a QST test, you can answer like, are there therapies that could help my condition, my neuropathy, my type of neuropathy? So can nerves heal? The answer is yes. It's not been any different for more than, according to their research, for more than 100 years. That's not an exaggeration. That'll sound so crazy. And this one, I mean, you can go to any of the sites that I'm talking about, but then this one is from Mayo. And this Dr. Winbank is a renowned neurologist on the topic of neuropathy. So Mayo says 1 to 3 millimeters a day. What is that going to mean to you? Slow. Kind of like parts of this presentation for you. A little slow. But nerves can change, and they need guidance to do it. And they need, it's going to be probably, therapeutic intervention. You have to be intentional. And again, I got to say, even if you want to stay the same, you're going to have to be intentional. What are your options? Copied right off Johns Hopkins Medicine website. Just read the highlighted portions with me. Over-the-counter pain relievers, you probably tried them. Prescription medications, anti-seizure drugs like gabapentin, Neurontin, Lyrica, amitriptyline, antidepressants. There's a lot of medicines. Sometimes they'll use surgery to destroy the nerves, injections to temporarily impair the nerves so you don't feel it. And I'm not minimizing the use or treatments, any of those as aforementioned. I'm just pointing out for you that none of them will change the nerve cell. They will only make you less aware. It doesn't mean that you shouldn't use it. Try it, use it to sleep, get through the day. I understand. I have people that have to use it, have to take the medicine. And then we have people that are able to reduce the dose or go off of it. This is another from the National Institutes of Health. There are U.S. National Library of Medicine, National Institutes of Health. There are strategies, there are therapies that exist to help nerves regenerate, enhance axonal regeneration. Axon or axonal is just a fancy word for nerves. So it's possible. What can be done? Nerve fit assessment. This is the absolute best thing you can do. It is a complete history of your neuropathy and your balance problem. We do a calculated fall risk test. In addition to that, extensive balance testing, and of course a QST. You have to know where are you. You can't use pain. This is not a challenge. I'm not challenging you. It's not a good idea. So if you go back to Dr. Winbank from Mayo, who's I read a lot of his research on neuropathy. He says that only half of the people that have neuropathy have pain at all. Half of the people will have no pain. And a lot of people have mild. They erroneously, and I'm not making you wrong, but they think they can live with it because it's not, debilitating. If it just stays like this, and what they mean, and again, it's legitimate. They're saying it doesn't hurt that bad, so I can live with it. I understand that, but unfortunately, damaged nerves die off. They're not staying the same. It's progressively getting worse. So it's a bad idea, and this flies in the face of our societal norms. Meaning, my patients are 65, 75, 85, and in their 90s, and the worse something hurts, the worse it is. That's not always the case. That's not the case, period, with neuropathy. Yes, it'll hurt worse, it can get worse, but people get to this point where they've had it and it hurts and I have burning, and then that starts to dissipate. And most people, it's hard for them to tell because they're on medication that dulls the pain symptoms, so they don't even realize that their nerves, so it takes a working nerve to send a pain signal, and their nerves are dying off. They're working less, and they have less of them. So you do yourself a favor. Have a QST test done for your neuropathy. It is very well documented. It's been around for many, many years. It's a validated test in medicine. You need a QST. You need it done probably a couple times a year, but at minimum once a year. And then with this data, with this information, then we can put together a nerve fit therapy plan. The nerve fit is a breakthrough therapy program for neuropathy and balance problems. You'd want to do this so you can walk without a worry of falling. Maybe have less pain when you want walk or you want to exercise. Travel again, so you can do things around the house. Someone who was literally yesterday in the clinic, someone was remarking, about doing yard work and plants and leaning forward, and they don't feel like they keep going anymore. They used to just keep tumbling forward and they couldn't stop themselves, and now they can. Walk on uneven terrain around your yard or your property, your land. Be able to sit for a while and get up and not stagger around like you've been drinking, whether you're drinking or not. Hopefully not with neuropathy. Play golf. Fish. Do activities that you enjoy. Get your life back. Do the things you want to do. Operate a motor vehicle and have confidence. 2 times in the week as I'm recording this, 2 occasions, 2 different people told me how they navigate by gauging where their knee or their hip is if they're pressing on the gas pedal or the brake. That's scary. And unfortunately, I hear that description on a regular basis, and it puts them at risk and other people. Most people can manage this. You don't have to sit idly by. I mean, what can you do? Now what? Get an appointment. Give us a call, 1-855-FIX-FEET. Have a nerve fit assessment done, and then you can get a nerve fit plan, and you can get your life back and get back to doing the things you want to do. I mean, we have this strategic application of therapies based on the testing that you go through in the history. You can go from having painful feet and poor balance, feeling down, not feeling like doing anything, to more energetic and sure-footed and feeling better. Life is too short to miss out on doing the things you love. Neuropathy and balance are no fun. They will steal your life. Don't be held back. You were meant for more. Dr. Ryan K. Lewis, D.C., Missouri Pain Treatment Center, 1-855-FIX-FEET. There's the team. Come join us. I look forward to talking to you.